My name's Richard Anderson. I'm Professor of Clinical Reproductive Science at the University of Edinburgh, and I also work at the Royal Infirmary as a specialist in infertility and reproductive endocrinology. So one of the key functions of the ovaries is to produce the hormones. That's basically estrogen that will, in the immediate obvious cause of that is to have your periods, but it's now very well recognised that estrogens are important for all sorts of other aspects of your health now and for the longer term. The most established benefit of estrogens is keeping your bones strong and healthy, and that's why in older women you'll often see or hear about them getting osteoporosis and thinning of the bones, and that's really an inevitable consequence of estrogen deficiency, but can be pretty well completely reversed with hormone replacement, with taking estrogen combined with things like exercise and calcium and vitamin D in the diet as well. So estrogens will be very important in protecting your bones against premature osteoporosis and early fractures. There are all sorts of other things that estrogens now are increasingly thought to have a major effect in maintaining women's long-term health. And a particular issue here is heart disease and protecting against early heart disease in healthy young women up until the age of the menopause. And there's also some evidence that estrogen also is important in preventing aging of the brain. So keeping your brain healthy for as long as possible is clearly a very important thing that we all want to try and do. Another common problem is sexual function. So after the menopause and after not producing the hormones, you can get a lot of problems with vaginal dryness, and this can lead to difficulties with sex, often very sore vaginal penetration, and that will also impact on how interested you are in sex, because of course if it's painful, it's not something you want to do, and this can then lead on to relationship difficulties as well. And many of these symptoms are really very readily addressable. So they reflect a lack of estrogen production from the ovaries, and so hormone replacements with estrogen or estrogen with progesterone can often be very, very effective in restoring these problems. So there are a variety of ways in which you can take hormone replacement therapy. Perhaps the most common is tablets, and that's pretty straightforward. Unlike the combined pill, when you have a week off every month with HRT, you tend to take a tablet every single day. But if you've not had a hysterectomy, if you've still got your womb, then it will need to have some of the hormone progesterone as well as estrogen that will give you a period every so often. Not necessarily every month, but at intervals. So that's an important part of that. As well as tablets, many women take HRT in the form of patches, and that can be very, very successful as well. There's perhaps some evidence that actually patches are slightly better at reducing the risks of blood clots and things, but actually it generally boils down to individuals' preferences as to whether they prefer to take a pill a day or a patch. And some women do find patches difficult with sort of irritation on the skin from where the patch has been applied, or they do a lot of sports, they do a lot of swimming, and they find that it's just a bit awkward. But if patches suit you, then they're a great way of taking the hormones. Sometimes the sexual side of things with the vaginal dryness, that needs some local estrogen treatments into the vagina as well as tablets or patches as well, just to really get things back to normal. Sometimes the patches and tablets don't give quite enough hormone production to really get the vagina back to how it was beforehand. So don't be afraid of asking your doctor and discussing these things, because they'll be very keen to help you, and there are lots of remedies available. So HRT's had a bit of a bad press over the last few years, with studies in older women showing increased risk of breast cancer and particularly blood clots. But it's important to remember that those studies were largely included women who were actually already some years after a natural menopause, so were already into their later 50s and even into their 60s. So that's a very different situation from younger women in their 20s, 30s and 40s taking HRT, who are intrinsically healthier and are also taking hormones that they ought to be producing anyway, but they're not because of the treatment they've had. After treatment, It may be that your cycles are back to normal and everything seems to be great and your fertility is probably going to be unaffected. But if you are worried, if your periods have not come back or they're irregular, or you've been trying to get pregnant and it's not worked out, then do speak to your doctor about this, because they can do some assessments, they can refer you on to a reproductive medicine specialist team if necessary, and there's lots of help that can be brought out to help you through this difficult time. And sometimes it may just be a matter of thinking, actually, there's some tests that are reassuring and that things should work out, but they can also identify where there are problems, and then you can get on with the right treatments as soon as possible.